Welcome back, Fact Not Fiction fans. We have a special guest with us today. It's Nurse Valley. She is an OBGYN here in Mississippi.
Welcome.
Thanks guys.
So could you talk to us a little bit about some of the real world situations you've encountered at your clinic or questions that you get when people come in?
So one big one is that if I'm bleeding, that I can't be pregnant. So if I'm having my period, I'm not pregnant. When actually you can be pregnant and bleeding at the same time.
Really?
So all women have different cycles. They have different lengths of cycles, and they can even have bleeding that occurs between their cycles. So it's possible. And it's even possible to be pregnant and be bleeding. You can have bleeding early in the pregnancy. So it's important that if you are concerned that you may be pregnant and you're not using birth control, that you get tested for pregnancy.
So when do you suggest that we take a pregnancy test in the event that we have, unprotected sex?
Anytime that you're concerned that you may be pregnant is a good time to take a pregnancy test.
Okay.
The efficacy of the pregnancy test, meaning how well it works, will get better and better the further you are in your pregnancy.
Right, so say a girl has had unprotected sex and she is worried she might be pregnant. Getting a take-home pregnancy test and doing it the very next day may not be a guarantee and may not tell her she may need to keep testing. Right?
That's right, absolutely. You can't assume just because you have a negative pregnancy test that you're definitely not pregnant.
What about birth control, like oral birth control?
So that's a big one. Birth control pills have to be taken exactly the same
Right.
time every day and taken every day.
Sometimes if you miss one, you could upset the cycle and put
That's
yourself
right.
at higher risk.
That's right. And it's important to note that if you do miss one, it's okay. You just take two the next day. If you miss 2 days, you take 2 now and take 2 the next day and keep going. But if you miss 3, it's 3 strikes, you're out. 3 strikes, you're out means throw away the whole pack of birth control pills, wait till the next cycle, and then start a brand new pack.
And not have unprotected sex during that gap.
That's right.
Right.
Using a backup method, that's a big one for sure.
So Nurse Valley, there are all kinds of types of contraception out there beyond just the condom. Can you talk about all those various types?
So there are more long-term types of birth control methods that you don't have to remember to take every day. So therefore, your chances of getting pregnant decrease because you're using something that's lasting. So the patch you can actually use and change once a week.
Oh, wow.
Okay.
The Nuva ring, the ring, you can actually leave in for a whole month.
Wow.
And then there are forms like Depo-Provera, which is an injection that you get every 3 months. And then there are implants, the rods that go in your arm, and those can last for up to 3 years. And then you have even better methods like the IUDs, which can be left in for 3 years to 10 years. So emergency contraceptives are used like a plan B when you think that maybe I did get pregnant, and you can go ahead and take those pills. It's basically a high-dose birth control pill.
Oh, okay.
And you can go ahead and take Plan B just to make sure that you're covered.
Is there like a window that I have to use it in?
It's best for you to use it within 72 hours.
Okay.
So
So basically 3 days.
that's right. But the
Okay.
sooner the better.
right.
But the emergency contraception does not help if you're already pregnant, right?
That's absolutely right.
And it does not help someone prevent any kind of STI.
That's right. It doesn't provide any form of prevention against STIs.
Right.
So that's an important point there. STIs, they can be prevented best by barrier methods.
Okay.
Should be
Like a condom.
condoms or dental dams.
That's right.
Well, there you have it, ladies and gentlemen. You can go to the website, factnotfiction.com, and find out tons more information about STIs, pregnancies, emergency contraception, and even your local healthcare providers. Our information is there for you.